Hi all, good morning everyone. I am Annai Satya, going to present the topic about hospitals, which is the fundamental concept in nursing foundation. So introduction about the hospital. So hospital is an organized institution that provides investigation, treatment and care to patients. The word hospital is derived from the Latin word "hobs" meaning guest. In modern healthcare, hospitals are not just treatment centers, they also function as a teaching institution and research centers. For example, a district hospital may treat patients while also giving training to the nursing students and medical students. So, hospitals nowadays are centers of care, education, and research. Next, we move on to the definition of hospitals. According to World Health Organization, hospital provides diagnostic services, therapeutic care, rehabilitation services, and preventive services. Hospitals are also a part of the larger health and social system. So they provide services such as outpatient care, inpatient care, and emergency services. So hospitals ensures continuous and comprehensive health care. So classification of hospitals. So hospitals can be classified based on several criteria. That is depends upon the bed capacity, ownership of the hospital, objectives of the hospital, system of medicines and the management. This classification helps us to understand how hospitals functions in different settings. So, based on the classification by size and bed capacity, hospitals are classified based on number of beds. Small hospitals up to 100 beds, medium hospitals up to 100 to 300 beds, and large hospitals around 300 to 1000 beds. So, based on recommendations, teaching hospitals should be more than 500 beds, district hospitals should be around 200 to 300 beds, and taluk hospital should be around 50 to 200 beds, whereas community health centers should have 30 to 50 beds, and primary health centers, that is PHC, should have 6 to 10 beds. For example, a 750 bed medical college hospital is considered as a teaching hospital. Then, classification by ownership or control. So, hospitals are also classified based on ownership. Government hospitals and non-government hospitals. So these government hospitals are run by central or state government and also funded by taxes. Whereas non-government hospitals are voluntary hospitals, private nursing homes, and corporate hospitals. For example, a private nursing home may be run by any individual doctor. Next, we move on to the classification by objectives. Based on objectives, hospitals include teaching and research hospitals, that is, teaching cum research hospitals, specialized hospitals like TB care, ENT care, orthopedic, pediatrics, and gynecology, etc., general hospitals, rural hospitals, and isolation hospitals. For example, a TB hospital is meant only for tuberculosis diagnosis and treatment. Next, we move on to the classification by systems. So hospitals are also classified by type of care given. So there may be a two. One is long-term care, another one is the short-term care. So long-term care is for chronic diseases like cancer, leprosy, and tuberculosis, whereas short-term care is particularly for acute illnesses like pneumonia, asthma, gastroenteritis, etc. And also, based on the alternative system of medicine, there will be allopathy hospital, Ayurvedic hospital, homeopathy, and Unani. Example, a cancer hospital provides a long-term treatment. Then next we move on to the classification by management. So based on the management, the hospitals can be run by government bodies, autonomous institutions, private organizations, voluntary organizations, and corporate sectors. Example, CMC Vellurisi Voluntary Hospital. Then organization of an hospital. So hospital organization involves division of activities, assignment of responsibilities, delegation of authority, proper communication and coordination. Here we have an illustration that hospital management have top level hospital management hierarchy, middle level hospital management hierarchy, and low level hospital management hierarchy. In the top level, we will be having a dean of the hospital, hospital administrators, and specialized surgeons. Middle level, we have a normal specialist, silent doctors, nursings, and then lower we have a physician assistant and medical students. Next, we move on to the organization relationship. So there are different types of relationship in hospital organization. We have a line relationship, lateral relationship, functional relationship, and staff relationship. Line relationship in the sense that is superior to subordinate. The relationship is from superior to the subordinate. Lateral relationship between the two departments. Functional relationship between the authority over specific task, and staff relationship depends upon the advisory role. Example, laundry services supplying linen to wards through functional coordination. So next we move on to the functions of hospital. The main functions of hospitals include care of sick and injured, diagnosis and treatment, prevention through immunization, health promotion and rehabilitation. It also includes outpatient and inpatient services, research and training. Example, immunization clinics prevents diseases in children. At last, the healthcare team members and their roles. So healthcare team includes doctors, nurses, dietitians, physiotherapists, social workers, pharmacists, lab technicians, psychologists, etc. So each member plays a unique role in patient care. So next we move on to the role of nurse. So nurses play a vital role in hospitals. He or she provides direct patient care, assisting in diagnosis and treatment, educating patients and families, and coordinating with other healthcare team members, and then maintaining patient safety. So here in hospitals, nurses are the backbone of hospital care. In conclusion, To conclude, hospitals are essential institutions that provide comprehensive healthcare through organized systems, teamwork, and patient centered care. Thank you.